We do have some good news for all parents tonight who have been really anxious because they want to get their kids vaccinated against COVID-19. We learned that the FDA is now considering Pfizer's request for emergency use authorization for its vaccine for kids ages 5 to 11. If approved, it could be rolled out as early as November. The vaccine is already now approved for kids 12 and up. The FDA advisory panel will meet October 26th on the earlier kids. Rich and I talked to school nurses today to get some perspective on how this could impact the local classrooms.
Earlier this school year, before a mask mandate in all Lawrence Township schools, hundreds of students were missing school because of close contact tracing quarantines. That number is now less than 100 throughout the school district. Keeping track of who was within 6 feet of someone who tests positive for a total of 15 minutes and was or wasn't wearing a mask, who can or can't come to school, and for how many days, has become all-consuming for school nurses.
An approved COVID vaccine for children ages 5 to 11 would cover most elementary school students and would provide a huge relief to the contact tracing job of school nurses.
I do think it will decrease the amount of days absent that kids would have. If you are vaccinated, you don't have to quarantine if you are a close contact, so you don't have to miss that school. And if you're vaccinated, hopefully you're not getting COVID, so you're not missing school because you didn't get it.
Children ages 5 to 11 would receive 2 doses of the Pfizer vaccine 21 days apart. The dose is only 1/3 the size given to adults. Another age group eligible for the vaccine should help continue the decline in positive cases.
Increasing vaccination rates will help with that, but it's not even just for children. It's increasing the vaccination rates of anyone who is eligible to get vaccinated will help us keep kids in school.
And give the school nurse more time to take care of kids instead of pandemic data entry.
Today we talked with U.S. Senator Todd Young, and he told us that he supports vaccines for kids 12 and under. If approved by the FDA, he says he wants to get his kids to get the shot as well.
It's really remarkable. So I think to the extent that parents are comfortable having their children vaccinated, that's a good thing. We, of course, should not only allow that, but encourage those parents to make that decision.
While he supports the vaccine, the senator says he does not support federal vaccine mandates, saying instead that's an issue that should be left up to state leaders.